best you can. And I'm supporting her leg here, but I'm not really pushing with it or anything. I just want to see what she does actively. I'm looking for range, quality, and does that change your symptoms or not? And can you straighten your knee all the way? All the way out and down. Good. And try to give it a little bit extra as much as you can. And just see how she does. Range, quality, and symptom provocation. Okay. Now, can you sit up with your legs over the edge of the table? The other two motions that exist at the knee that we don't think about so much is tibial internal and external rotation. That is something we can ask to see if she can do that. So are you able to turn your leg that way from me? Okay. So she does a good job everting her foot, but you got to see what the tibia is doing. Good. And relax. And she moves it some. Can you turn it the other way? Good. Okay. And she gets it some. But her compensation, she's definitely a foot kind of person, right? So when you're sitting there, you gotta be able to move it out and in, out and in, without trying to get that foot too involved. Her immediate motion's like, I'll get it in there. I'll get it out there, right? And she's trying to get it through her leg extension. So what muscles will primarily tibially internally and externally rotate? What muscle does that? What muscles do that? Anterior tibialis, what does that attach to? I'll tell you the base of the first cuneiform and metatarsal to the tibia. So can it internally, externally rotate the tibiofemoral joint? No, because it doesn't cross the tibiofemoral joint, right? It's got to be a muscle that crosses that joint. So what? Hamstrings, yeah. Yeah.
Sartorius weekly, right?
Sartorius, it's a flexor and it can do some, well, it's more of a hip rotator than it is a tibial rotator. It would be very weak. It would be very weak to help with that. Really, you're primarily looking at your hamstring. That's actually a hamstring. So when they go for their foot, they can do that all day long. That tibia is not going to move. There's nothing that really crosses there. That causes inversion, eversion of the foot. Her everters are her fibularis muscles. They attach to the fibular, so they are not going to move the tibiofemoral joint. Right? Okay. So that's what I'm looking for. So passively, what I'm going to do is actually we can do that. We can do extension sitting up. I can come in, and we're doing this like now. I know we were looking at this before, but guess what now? I can do full extension and see how she does. And then we can go through flexion of the knee and see how she does. If you're hit in the table, then you cannot say I did full passive range of motion, okay? So I'm going to show you my method of always doing active and passive. Passive range of motion is with the person laying down. So can you lay down for me? And just so everyone can see, I'm going to come to this side again. Scoot towards me. My way of always doing passive range of motion after the active was to do it laying down. And so what I can do is just bring the leg up. And for flexion, what I would do is I would start with my arm over the top of the tibia, but cradling underneath the other side. And what I would allow me to do is to come in and give it a full flexion. You can just use your hand to give it a little extra overpressure. My method was to always just use my body because I can just flow right into it. But that's up to you to decide how you want to do that. So flexion, hold it for a few seconds. For extension, you want this arm underneath, supporting the ankle and the tibia as you fully extend, and then you can give it that little bit of extra overpressure. Always watching your patient, asking, how does that change your symptoms? Comparing the amount of range I got actively to what I'm getting passively, and what are the symptoms, okay? All right. Can you sit up again? For tibial internal, external rotation passively, you can do that. That you do have to do sitting up. The knee needs to be in that 90-degree position. In a fully extended position, you have that screw home mechanism. If you haven't gotten there in kinesiology yet, it's coming. Once the knee's in that screw home mechanism, you're not going to get any internal, external rotation. So I can do passive range of motion testing for tibial internal, external rotation. You can basically grab down at the ankle above the malleoli, okay? But you can also support from the top too to look at tibial external rotation and tibial internal rotation, okay? Resisted testing can all be done in sitting. So what I'm gonna ask to do is person to kick their leg up, okay? And then what you wanna do is you want to have them break the knee. Again, don't allow them to sit in that screw home mechanism. You're gonna ask them to bend their knee down about that far and hold and let me move you. The open pack position for the knee is about 25 degrees. I should say for the tibial-femoral joint, it's 25 degrees of flexion. So that's a good spot to test extension range of motion. For flexion range of motion, you can let the leg go all the way down and hold on, let me pull you out. And just see how well they do. And if you need to be and you feel like they're getting their hips involved, you can stabilize from the top with that and hold on, let me pull you out. Good? You can test resisted tibial internal external rotation. So if I'm internally rotating her tibia and I tell her hold on, let me move you, she needs to be able to turn against my bottom hand and don't let me turn you the other way. She's doing a good job of it. Good. Okay? So knee is flexion, extension, but also tibial internal external rotation. Okay? Active range of motion is done laying down. Passive range of motion can be done sitting up. Okay, but especially for hip, I'm not saying hip, but I mean knee flexion. If you're hitting your table, you might need to lay them down to get the full amount of flexion. Okay, resisted testing can all be done sitting though. Okay, that's
for
me.
active.
Yeah.
Why did you hold my heel? Just so I'm not shearing against the table, or?
Yeah, just so you're not sliding against the table, and I was just kind of supporting it. Wasn't helping it out in any way, shape, or form, but I don't want to see how her muscles overcome gravity and friction. I want her to just actively move the joint.